Hello, welcome to this NMC OSCE YouTube video. My name is Hannah. I am a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead. And I also provide one-to-one small group NMC OSCE support, tutoring and preparation. So I'm updating this video for the IM injection. So covering the new medication, which has been introduced into the test centres of streptomycin, and also just updating the video to demonstrate it without the use of PPE as well, which was also removed a few months ago from the NMC marking criteria. Okay, so intramuscular injection is a 12-minute clinical skills station. Obviously, given a medication, so the same as our other medication clinical skills, we need to make sure we have done those ID and allergy checks. We obviously need to read and confirm the validity of the prescription. We need to do our verbalise and do our skin checks. We need to prepare and administer the IM injection using the correct technique, and we obviously need to do the documentation on the medication administration record as well. So where do we give the IM injection? So two most common sites is your deltoid muscle, so at the top part of your arm, approximately 2 to 3 fingers, and below your projection of your collarbone. And then that can take small volumes, so up to 1 ml. So suitable for vaccines. And the other good site is the lateral side of the thigh. So the outer aspect of the thigh, basically between your kind of top of your femur and the knee, and you put a hand width up from the knee and below the top of the femur, and you can inject it in the middle of the thigh there. This is good for larger volumes, and with the changes to the medication of streptomycin, the guidance is that it should be given into a large IM muscle. So I would teach and prefer to use the lateral thigh muscle instead of the deltoid muscle now for this station. We always avoid the dorsal gluteal site. This is due to risk of damaging the sciatic nerve. And there's also your superior gluteal artery there. So we want to kind of avoid that site as much as possible. So medication. So like I said, traditionally this station has been the administration of hydroxycobalamin. Recently, it's been nurses have been getting streptomycin. So streptomycin is an antibiotic predominantly used in the treatment of TB, tuberculosis, and endocarditis. Some of the common side effects can be decrease in appetite, some bronchospasm, chest discomfort, diarrhea. It can affect auditory deafness as well, and patients can sometimes get a tingling or numbing sensation in the face as well. The dose is based on weight, so it's 15 milligrams per kilogram, and they can have that as a daily dose, but up to a maximum dose of 1 gram. So if our patient, for example, is 70 kilograms, the dose would be 900 milligrams at 15 milligrams per kilogram. In the exam, the stock dose appears to be 1,000 milligrams per mil, with a prescribed dose of 900 milligrams. So if you've got 1,000 milligrams in 1 mil, each 0.1 of a mil will have 100 milligrams. So we'd want 0.9 of a mil to get that 900 milligram stock dose. And in the exam, it is a pre-made dilution. So in practice, it's a powder that we'd reconstitute with water before administration, but in the exam, it's just a pre-made dilution. So you just need to draw back the amount of fluid within the vial to get. So I'll just run through hydroxycobalamin because it has been a frequently used medication in the NMC OSCE exam, just so you're aware. It is a synthetic form of vitamin B12, which we use and give for the treatment of pernicious anemia. Some of the side effects can include feeling nauseous and having some diarrhea, and you obviously get the same pain and swelling around the injection site for 24 to 48 hours. The dose for this medication is 1 milligram, which is given every 2 to 3 months. And in the exam, the stock dose has traditionally been 5 milligrams in 5 mils. So to give 1 milligram, we need to administer 1 mil. This is a smaller volume of medication, so it is appropriate to give it into the deltoid. Well, it's not small, it's the same volume, but it is appropriate to give it into the deltoid. It doesn't have to go into a big muscle mass like the streptomycin. So equipment, so you'll need the same equipment and it's the same injection technique, it's just a change of drug, so don't worry about that. So we need our filter needle, we need our green IM administration needle, and if you're going into the lateral thigh, I would definitely recommend the green over the blue because the green is longer and would reach that muscle better. We need a syringe, 2 ml syringe, some non-sterile gauze and our sharp spin, and like I said, they've got rid of PPE quite a few months ago in the updates then. So I have our scenario, medication administration records. So I'm going to go through the streptomycin because this is a new scenario being used. And this is going to be, most probably will be a hospital-based scenario as opposed to the hydroxycobalamin, which has been traditionally a community-based scenario. So prescription might be written as a once-only medication. So again, we're just looking for all those 6 rights of that prescription to confirm it's valid and clear. And station breakdown. So the same as with our other medication clinical skills. So we obviously need to do our key principles, which must include our ID, allergy check and consent. I'm going to read the prescription, confirm it's clear, valid and legible, collect and check all our equipment. We need to assess the injection site, make sure it's clean and no signs of infection, swelling, inflammation, etc. We need to prepare the medication using a strict aseptic non-touch technique. We need to administer IM injection using the correct technique, dispose of our sharps and waste, and document our medication administration. And obviously just finish that station, checking the patient is comfortable and ending the station professionally. So key principles, hopefully you're familiar with these now. So we don't have to do the safety, but we should ensure privacy and dignity. Going to decontaminate our hands using the World Health Organization 7 steps. Introduce ourselves using hello, my name is. Confirm the patient's ID, date of birth and hospital number verbally and against the wristband and medication record. So most probably going to be in a hospital setting, like I said, so we must do the wristband. Ask and confirm allergies, and again, a checklist against the wristband and the medication chart. Remember, streptomycin is not a penicillin-based antibiotic, so it is safe to give in someone who has a penicillin allergy. Explain the procedure, again, consent, and make sure the patient is comfortable. So again, explain that you need to give the injection. You could offer the preferred sites at this point as well. And, you know, explain that it's going to involve a needle. There's going to be a little bit uncomfortable, but not for long. Then we need to read our prescription. So again, we're reading that full prescription to confirm it's clear, valid and legible, all the patient's details and the allergies. So the front page, your hospital medication chart, you want to read exactly the same as you do in that implementation station. So all your patient details, your prescriber's details, your allergies, your medication risk factors, and then look through the chart until you find your streptomycin prescription. Like I said, it would most probably be like a once-only medication, in which case we're going to read the date. So the date is today, the drug is streptomycin, the dose is 900 milligrams, the route is IM, intramuscular, time required is 12 o'clock, which is due at our time, prescriber signature is P right, and prescriber's print name is right with a bleep number 642. It hasn't been given, so I can confirm this prescription is clear, valid and legible. Then I would go and collect and check my equipment. So I'm going to do a hand hygiene point here because I'm leaving the patient to collect my equipment. I'm going to get my medication. So I'm going to get my streptomycin, confirm the stock dose, the expiry date, confirm what's written on my prescription, the prescribed dose, and then how many mils am I going to give to get from my stock dose to my prescribed dose. Okay, so if I've got prescribed 900 milligrams, and I've got a stock dose of 1,000 milligrams in a mil, I need to give 0.9 of a mil. I'm going to get my syringe, my pink or red drawing up needle, my green administration needle, verbalising that all the packaging's intact and that the expiry dates are present, piece of gauze and my sharp spin. I'm going to go back to the patient, return to the patient's bedside, decontaminate my hands and do my second ID check because we've returned to the patient in a hospital setting, so this is important. Name, date of birth, hospital number against the wristband and the medication chart. I would then need to assess the injection site, so ask the patient to expose the area and we need to be assessing that site for any signs of inflammation, infection, edema or skin lesions. And we also need to say that the skin is clean, looks visibly clean, and you do not need to clean it. Okay, there's no evidence, minimal evidence for alcohol cleaning injection sites, IM and subcut. So as long as it is visibly clean, we don't need to clean that. We then need to prepare our medication. So important hand hygiene here. We're not using PPE. We've touched the patient's skin to assess it, so we must decontaminate our hands here. We're going to attach the drawing up needle to our 2 ml syringe. We're going to withdraw back the correct amount, remove the red needle just at the hub, don't recap it, put it straight into your sharps bin, attach our green administration needle. You can do another hand hygiene here if you want. It's not essential, but we're not using gloves, so we just want to make sure we're clean. And then we're going to administer the IM injection. So for our IM injection, it doesn't matter what medication you're giving, it's the same technique. So we're going to stretch the skin, insert the needle at 90 degrees, leaving 1 centimetre of that needle showing. And then we're going to inject the medication slowly, so 1 ml every 10 seconds. So our 0.9 mils we could deliver over 9 seconds. We need to wait 10 seconds before withdrawing, and then we would withdraw the needle, put it and release the skin stretch once we've taken the needle out. So we've released the S trap back. Put your sharps directly into the sharps bin, don't put them down, and then get your gauze and put it gently over the injection site, and making sure not to massage the area. Once we've done that, disposed of our waste, we need to decontaminate our hands, we need to prioritise our documentation. So we'd sign and the time given on the once only. Remember, if you've got the full hospital chart, to go back to that front page and complete the administers details on the front. So the same as you do in that implementation station. So your name, initials, signature, and your base, so where you are working in that clinical scenario. So don't forget that in the station. If we haven't disposed of any waste, obviously go back and do it then. Remember, if you're tight on time, always prioritise that documentation, and you can verbalise your waste apart from your sharps, which you must put into the sharps bin. Obviously, decontaminate your hands and finish your station. You can just check the patient is comfortable, doesn't need anything, that they've got the call bell, they know when to call you. Maybe if they need any assistance or having any adverse reactions, you can say that you'll come back and check them within the next 30 minutes, make sure they're not having any adverse reactions to that medication. And then if you've got any time left, always double check your documentation. So critical fails for this station is obviously not doing your patient ID and allergy checks, not correctly reading the full prescription and confirming it's clear, valid and legible, administering the wrong dose of medication, so not drawing up the correct amount. So be careful with that, especially with the medication change. Not using the correct technique to inject the medication. So remember, you must be stretching the skin and doing the correct IM injection. Not decontaminating your hands prior to preparing and administering the injections. That's really important. Removal of PPE, but we must demonstrate good hand hygiene. If you resheath your needles or do any unsafe sharps management or disposal, that will be an automatic critical fail. And if you, like with all your stations, incorrect documentation on the medication chart will also be a critical fail. So I hope you found that helpful. Don't forget to like, share and subscribe if you find my videos useful, and please add comments. I try and answer them as soon as I can, and with any information that I have that will support you.